More pregnant women are admitting to using marijuana, especially during the very critical first trimester. A new study in the Journal of American Medical Association found that the number of pregnant women who admitted to using pot in the last month doubled between 2002 and 2017 from 3.5% to 7%. And more women say they're using it in the first 3 months of pregnancy when birth defects can develop. The rate went from just under 6% in 2002 to more than 12% in 2017. The study also found that few women are seeking their doctor's advice before using marijuana. Fewer than 1% said their doctor actually recommended it. So my next guest is an expert on a lot of things. A personal friend of mine, and she is well versed in women's health. Dr. Leslie Apgar is a retired OBGYN who is now the medical director of a cannabis dispensary in Maryland and has co-developed several marijuana products specifically for women, and she joins us now for Skype. Dr. Apgar, thank you so much for joining us. It is wonderful to see you. Oh. I do want to ask you, though, because you develop products for women and you don't necessarily offer it for women who are pregnant, right? But is it safe?
You know, Elizabeth, I wish I could give you an easy answer there. The American College of OBGYN says a definitive no, that we just don't have good data to suggest that cannabis use in pregnancy or in breastfeeding is safe. So the easy answer is no. So it's really hard because patients come to me all the time because of my OBGYN history. And I can tell you that I've taken care of some pretty sick patients in pregnancy where they had nausea and vomiting and needed to be hospitalized. And we used medications to treat them that weren't necessarily safety tested the way that we would like. So we're very excited to see some new data coming out on these new studies so that we can give people accurate information about what the safety really is.
Well, that sort of leads me to my next question, because women struggle with so much when they're pregnant, and oftentimes it could be anxiety, it could be morning sickness, and they still have other children or they have work. So this could be an alternative for them that they may think is perhaps medicinal, safer than maybe a pharmaceutical. Is that right?
Yes, and the problem is that medical cannabis is all over our country now. I mean, I think there's 33 states that have either a medical or a recreational program. And so the misconception might be, because more people are talking about this and cannabis is starting to lose its stigma, that perhaps there is safety. And I think that what's happening with these studies is that more and more women are admitting to using cannabis because of that decrease in that negative stigma. But my personal belief is that we have all, humans, women, pregnant women, been using cannabis for a long time, historically for thousands of years. But now we're just starting to talk about it a little bit more.
Like you said, more people are talking about it. More states are legalizing both medical and recreational marijuana. So I'm sort of curious about, women are going to make their own choices, right? I want to talk about safety, where you're getting your products. How do you know that it's safe? I mean, if these women are going to make these decisions and they're perhaps being consulted by a doctor, what do they need to know about where they're getting these products and how it should be used?
Right. So one of the things that the medical cannabis industry has done is to institute really rigorous testing of the products so that the patients know that whatever they're consuming doesn't have heavy metals, doesn't have pesticides, doesn't have molds or other adverse products included. So we really encourage that if people are going to use cannabis, that they purchase it from a legitimate source, such as a medical dispensary, so that you can actually look for a certificate of analysis with each and every product that it's been tested and that it's safe.
All right, Dr. Apgar, thank you so much for joining us. We appreciate your expertise, and I'm sure that it's something we'll be talking about a lot in the future.
Yes. Bye-bye.